Acute, not to try to conflate either deliberately or mistakenly conflate the issues, because whilst I appreciate there are surgical improvements happening within the SWA, we also need to separate out what aspect or what contribution the elective overnight centre is making to that, because whenever I look at last week's announcement from the Trust, and whilst I applaud, and as I said in the chamber the other night, I applaud each of the booking teams and all the theatre nurses and all the auxiliary staff and the surgeons themselves, obviously, I applaud everyone involved. I do think I, and perhaps many others, will have a different definition of success to what the Trust and department might currently have. The figures last week were 164. I see the 172 now. 172 patients for an elective overnight stay centre in 8 months is pretty poor. It's more than poor in my opinion, and I appreciate, Mark, that you talked about the increase in the other elective work, but I would very much be of the opinion they're two separate strands. So one of my questions would be, how does the funding work with those lists? You talk about the 19.5 funded lists a week. How many of those are elective? How many of those are elective overnight stay centre lists? Are they split up such as that? Another question would be, how many of, and I'm talking specifically the elective overnight centre or stay centre lists. So how many of those lists, with 170 patients, you're probably talking about 40 lists really, or 40 sessions or 40 days. How many of them, so of those, how many of them were day case or how many of them were overnight, as is implied? Importantly, how many of them were actually delivered by non-Western Trust surgeons? And by that I mean surgeons who are travelling to Northern Ireland. And that includes, obviously, Mark himself. And I appreciate, Mark, I can probably preempt your answer. You'll talk about surgeons travelling from the Southern Trust. Obviously, we're in an open meeting now, so I'm not going to name names, but I'm talking about staff who've had no previous connection with the South West Acute Hospital. How many are, if there are any, how many surgeons have been travelling to the South West Acute along with Mark? In terms of Omagh, then, just very quickly, Chair, it was announced, Mark, it'd be useful if we could get a little bit more clarity or breakdown in just those Omagh DPC lists. You talked about the increase, and it's great to see the rebuild happening, but a year ago, whenever there was ministers in post, we were told, don't worry, Minister, the rebuild's well underway, and by this point we'll be at full capacity, and by this point again we'll be perhaps at even better capacity, and it just always seems that we're always a few months away from getting to where we should be. So my question would be, in terms of a year ago, it was probably over a year ago, Robin announced there were going to be 7 regional lists sent to Omagh DPC weekly. How many of them lists are currently being delivered? Because I think he talked about the figure, or there were figures being referenced about maybe 2,000 patients a year. And so it would be useful, and these are regional lists for the DPC in Omagh. I appreciate the Omagh DPC previously has been focusing quite heavily on Western patients, but specifically on the regional work. And then finally, Chair, my final point would be, I'm aware just from talking to clinicians from right across Northern Ireland, early starts or late starts, early finishes are still a big problem. And it was mentioned to me in the past that there are particular problems still within Omagh DPC. So it's just to really get an assessment on where we are with late starts, early finishes, whether it's still a problem, and whether the Trust now is currently content with the level of activity being delivered by Omagh DPC, but also specifically by the elective overnight centre in Enniskillen. Thank you.
Okay, thank you. Nobody else is indicating to speak first. I'll hand over to the Trust there, please.
Okay, so
Mark will answer those questions, Chair.
I'll pick up some